What's up, everybody? I am super excited. Y'all know I get really excited about a lot of presenters on our webinar series, but to be real honest, I don't really get this excited about a lot as excited about a lot of people like I do about my dear friend and soul sister, Dr. Cindy Howard. You know, I like to gush about Dr. Jay Greenstein all the time, but the greatest gift he ever gave me was an introduction to this beautiful and brilliant woman right here. She is a chiropractor in the great state of Illinois. I'm super jealous, but she was closer to me. She is a graduate of the University of Wisconsin. She is got her degree in chiropractic from National. That's right, isn't it? Because all my favorite doctors came from National. Oh, yep, yay. She has been working in private practice for over 18 years. She treats everything from peewee athletes to, I think your specialty, really, in my personal opinion, is helping men and women with functional med, hormonal issues, all kinds of stuff. Bless her heart. She kind of probably doesn't wish that Jay introduced her to me. Because I have an issue and I don't believe anything anybody tells me until it has been confirmed or denied from Dr. Cindy Howard. Anyway, she is just an incredible doctor. Last year, she was Chiropractor of the Year for the Illinois Chiropractic Society. There's a great story there that we'll have to tell you at the end if we have time. She's past president of the ACA's Council on Diagnosis and Internal Disorder. She's an ACA delegate. She teaches everywhere. And if you are lucky enough to hear her live and in person, if you see her at your state association event, you would be foolish not to attend because not only is it educational, she's hilarious. I mean, absolutely the funniest person. So anyway, that was a terrible introduction of you because I'm just like, I could go on and on. Like her list of accolades is pretty extensive. She is the bomb.com. You're like the Kardashians of chiropractic. Like you're super cool and beautiful and famous and fun. Paul's on here right now. He's probably like, okay, Christy, way to go. Totally sucked. I'm sorry, Paul.
Christy, you set me up. I don't quite have the rear ends that the Kardashians are carrying around or the skin tight suit, but you know, everything else maybe. So we'll see if I can live up to that intro. I hope. Oh my gosh, you do a great job, and thank you so much for truly. I mean, who says no to the great Christy Hudson? I mean, really, right? You ask and we show up and we perform and we do and we educate. So I'm really thrilled to be here today. Thank you.
Well, I'm so happy you're here. Not that I will never pass up an opportunity to hang out with you virtually or in person.
Well, you know, and it's a good thing you stay on top of me because, as we talked about earlier, I actually had the wrong time down. So in true Dr. Cindy fashion, I had to rearrange my schedule, and get everybody on board so that I could be here. And, we pull it off one way or another. We pull it off. It's great.
We sure do. And I do have to give a huge shout out to Paul Timko, who's on here also from Stop Pain.
Hi, Paul.
Hi, Paul. I'm a big fan of his products. And one of them, the migraine med saved me this weekend, actually, because I had the mother of all headaches. And Paul was like, here.
Yeah. It's great. We're going to talk about that a little bit today. We'll do the education piece first. And then part of that education is how we utilize some really great products in practice, right, in order to best help people and make us more successful. So we're going to do a lot of that today in our 47 minutes that we have left, right?
Well, then take it away.
Sounds good. Thank you, Christy. And really, and yes, thank you to Paul and the Stop Pain group who sponsors me to be here. We're going to talk about headaches, migraines, and headaches, or as many headaches as we can find. And, it's interesting because my background, which I will put up the slide here just to show you a little bit, is not only as a chiropractic physician, but really in the functional medicine space, in nutrition and internal disorders. And I love how Christy said a little over 18 years. We're pushing way more than that at this point. Those numbers are crawling for how many years I've been taking care of patients. But headaches are pretty prevalent, and there's lots of different approaches besides just the musculoskeletal realm, and we're going to take a nutritional and functional medicine approach today in the time that we have together. Anyway, pertaining to this list, there's really two pieces of important information, and they're right underneath my name, and that is just how to get a hold of me. That is my personal email and my personal cell phone. If after today you have any questions, comments, anything you want to share or anything I can help you with, please reach out. The best way is actually text. If you text me, give me your name, tell me you heard me on this webinar, from Stop Pain and ChiroHealthUSA, I will certainly respond. If you send me an email, it might get buried. You're still welcome to do that. But just so you know, those are the ways that you can reach me so that I can best help you moving forward. So what do we want to do today? Well, besides starting our own reality TV show that's going to run, same time as the Kardashians, Christy, you're going to be, my first guest on that show, of course. We've got a couple objectives that we need to cover. Number one, what can we really do for headaches besides, adjust, or besides our therapies that we typically use in our practice? Two, we want to know what are some of the common causes or triggers for the headaches, and then what do we do about those causes and triggers? How do we help? And then how do you incorporate topicals into your treatment protocols along with that? And I hope to tie a few of those things together and certainly give you a clinical pearl here or there today, and or even just a friendly reminder of some things maybe you even forgot about using that we can bring back into our practice to best help all of our patients that we see every single day. So I love stats and I hate stats, right? Depending on what you read, you're going to get different numbers all the time. But I think sometimes there's really a message here when the numbers are very large, right? It drives home the fact that this is a huge problem. And we know that over 36 million Americans struggle from migraines alone. And that doesn't even include all headaches. That's just migraine headaches. And if you take the number of people who are suffering from diabetes and asthma, that number is actually higher than both of those conditions together. So it's very, very prevalent. If you don't ask the questions, if your patients ever get a headache in practice, you're probably missing something that you could potentially treat, because a lot of our patients are really suffering from that particular case. They are the leading cause of disability worldwide. And we see that both migraine and severe headache affect anywhere up to 1 in 6 US adults and 1 in 5 women. And the most common type headaches are migraine and tension type. Now, as you're going to see today, there are other types of headaches as well. And sometimes I believe that when we read the literature, there are other things that could be just as prevalent. It's just that they go unreported, or we may not even be classifying them correctly. We've also seen that migraines alone are associated with anxiety and depression, which we know is a huge problem in this country. And we also have realized that the prevention and treatments are really underutilized in clinical practice, right? We may blow it off. We may not know what to do. We may refer them out for inappropriate medications. And there's so many things that we can utilize just face-to-face with that patient in order to help get them well. So again, if you dive in the literature, there are 4 common types of headaches that we see. One is the sinus headache. The second one is a tension headache. Third is migraine. And fourth is cluster headaches. Now, we are not going to spend any time today where we walk through the particular symptoms and how to diagnose these particular headaches. I'm going to make the assumption here that you know how to do that already. What we're going to look at is really some of the underlying triggers that we see. So how I like to look at it in my practice is very different. Rather than saying these are all the diagnoses that are very common in the office, which are important, I like to look at those diagnoses and say, okay, but what are the most common causes, right? So the philosophy being is when we render a diagnosis, it's excellent, 1, for coding, right? We know how to put that on an insurance form. And 2, possibly because we know what to pull off our shelf, or in the medical space, they know what drug to give. My philosophy is that although those things are really important and beneficial, what's even more important most of the time is what triggers that diagnosis, or in this case, that headache. And the reason that's important is because if we can fix that underlying condition, we get rid of the problem the patient walked in with, we get rid of the diagnosis, right? And we certainly avoid some of the medications or treatments that are given out there that may cause more harm than good in the long run. So here's what I typically see. I see a lot of hormonal headaches. So both men and women that come in with hormone disturbances and imbalances, and as a result can be the trigger for the headache. We see a ton of food triggers and environmental triggers, all the way down from very young kids, even babies, quite frankly, all the way up to the elderly. And the reason a lot of times we see that start in our babies is especially breastfed children will start being sensitive, if you will, sometimes to the things that mom was sensitive in eating. And at the same time, we know that a lot of the formulas and the baby foods really contain a lot of junk. And then again, we're exposed to a lot of wonderful chemicals and pesticides and all sorts, the list goes on of things that can trigger some of these headaches in our environment. We also see a lot of nutritional imbalances. So, I love when patients walk through the door and they say, hey, what nutrients do I need? And I say, I have no idea. And the reason I have no idea is because really, truly, I have no idea. And yet there's ways, and I'll show you, I'm actually going to show you some test results where we can look at some of the nutritional deficiencies in order to determine what a patient might need, realizing that some of these factors can play a role in the headache. We also see for a lot of the sinus headaches, fungal issues. And then, of course, there's our musculoskeletal conditions, whether it's spinal, muscular, et cetera, that can lead to the headache itself. So we're going to walk through those a little bit and hope to give you some good information, some places to look that may or may not be super common. Now, here's what's interesting, and this is a little redundant, but I left it in here on purpose. And the reason being is as I was starting to do literature searches, which I always do for my presentations, I wanted to find, okay, what might be a trigger for headaches. And if you read this, it's very interesting where they talk about the 4 main classifications of headaches. They also completely state in the literature that it's not just musculoskeletal, right? It's the hormonal, nutritional, and environmental causes. And it's about getting to the root cause. And they take this the one step further, which I love in their paragraph, talking about we need to take a proper history. We need to work up some labs, right? And in order to be successful, those things are really key components in the treatment of headaches. So let's just dive right in. I want to talk about Katie. Katie is a 46-year-old female. She is a current patient of mine. And she came in with headaches that she describes as migraines. She does get the aura. And basically most of her adult life, she says she's been suffering. And she will range anywhere from, maybe 1 or 2 a month, all the way up sometimes to 4, 5, or 6 migraines a month. Sometimes they're happening even weekly or multiple times during the course of the week. So while Katie has come in and she is a musculoskeletal patient and she does get adjusted regularly, it was not affecting the headaches at all. And there was no significant pathology on an orthopedic or neurological exam that had me overly concerned. So Katie and I decided to run what's called a micronutrient test. This is a fantastic way to answer that question when patients walk in and say, well, doc, should I take a multivitamin, or do I need vitamin E, or do I need more magnesium? The real answer is sometimes we just don't know. What's brilliant about a micronutrient test versus running this typically at, let's say, your lab, like a LabCorp or a Quest, is we can assess the nutrients in multiple ways. So we can look at their serum levels, the white blood cell levels, and on occasion, if it's appropriate, to run them in the red blood cell level. So you can see here, this is at Katie's actual results. And green is good. Red means there's either a deficiency or it's too high. And if you ever see anything in black, it means it's off, but not too big of a concern. Now, what's interesting is when we do some nutrient work, especially for migraines, not only are we going to look at the nutrients that she is deficient in, because she needs those anyway, but we're going to look at the specific nutrients that might actually be playing a role in the formation of headaches based on the literature, because even if it's printed in the green, it still might not be balanced enough where it's preventing. And what I mean by that is when you look at the ranges, sometimes we just make it into a range. And yet for that particular patient, it might still be enough of a deficiency that triggers a symptom. So as we look here, this is all of her vitamins that we decided to test. B2 is a big one, riboflavin. I'm going to show you a little bit of literature on that in a minute. Her levels were good, although not super high. So that's something I do pay attention for. She was a little bit low on her B6. As we creep down her vitamin D, it's good, it's not great. I love vitamin D between 60 and 80 typically. And another marker that we always also look at is folate. And I like that folate actually to sit on the real high side where it's even up over 20, especially when we've got a headache patient. So overall, so far, her vitamins don't look terrible. But as I just spit out, there's a couple that I might want to pay some extra attention to as we move forward. So interesting, when we do and we dive into the literature and we look, remember I mentioned folate. We look at folic acid and the levels of that, and we see that maintaining appropriate levels is very beneficial for migraine headaches. What this portrays is translation into our genetics as well. So a lot of us have trouble methylating some of our B vitamins, and getting the proper form as well of our B vitamins can be really important. One other little side clinical pearl for you in blood work is to look at what's called a homocysteine level. A homocysteine level reflects two things. One is cardiovascular health. It can be very inflammatory if it's up over 15, but usually even 12, we pay attention to it. And anything over 7, we assume plays a role in neurodegeneration. So as we're all sitting here, our brain cells are being affected. Some of us are losing brain cells faster than others, and that elevated homocysteine can be an indication. And what's interesting is the B vitamins, mainly B12, can help lower that homocysteine level. And what we see is when the genes also, that MTHFR gene, and a lot of us have that where we don't methylate vitamins, if we're not actually properly moving those through the pathways and absorbing them correctly, those deficiencies we know can actually trigger a migraine. Let's look at Katie's minerals and her metabolites. So as we go down the chart here, she was a little low on calcium. Her magnesium was great, or excuse me, her manganese was great. Her zinc a little bit low, copper not too bad. Chromium, which relates back to her blood sugar, good. Iron, okay. And now there's that red blood cell magnesium. Now again, that's in the green. But red blood cell magnesium, which actually is still really even hard to measure, a lot of times we don't pick up adequate amounts and it's very hard to absorb. I look for that number being 6. So we want that number where she's at 3.7 to be over. The 4 biggest signs and symptoms of magnesium deficiency are muscle aches and pains, headaches, insomnia, and anxiety. So the fact that she was suffering from headaches, this was a trigger for me in order to get that magnesium a little bit higher to see if that can offset her migraines. Metabolites look pretty good. Choline and acetylcarnitine. Methylmalonic acid has to do with how well she's actually absorbing her B vitamins, so she's doing a pretty good job there. And a couple electrolytes, her sodium and potassium, look pretty darn good. So then we move on a little bit and we start looking at her amino acids, right? These she's getting from her protein sources. They're also the precursor for her neurotransmitters or her monoamines. And we know those neurotransmitters from a brain chemistry standpoint are really important: dopamine, serotonin, GABA, etc. She's a little bit low on that valine. So we might want to take a look and see what food sources we could start to implement in order to help get that level up, thinking maybe there's even a neurochemistry trigger to her migraines. Then we're going to start to look at some of her antioxidants. There's 4 main ones that we look at. 2 of hers were pretty low. So the CoQ10 was low in the white blood cells. I didn't like that at all. I want that definitely mid-range. Her cysteine, which is a precursor for the glutathione, which is quite frankly probably the best antioxidant the body manufactures. Again, not amazing, but at least those were normal range. And then lastly, her selenium, which oddly enough nowadays we're talking a lot about because it helps support the immune system. And by the way, it also supports the thyroid gland and many other functions. Her selenium was also quite low in that white blood cell. So long-term nutrient levels, a little bit deficient, where we needed to start to talk about how we supplement those. And finally, on the micronutrient test, we looked at her fatty acids. We look at her omega-3s and her 6s. We look at the ratios of one to the other. You can see that her arachidonic to her EPA ratio down near the bottom there is a little high. And that's because, relatively speaking, the arachidonic acid sits a little bit on the high end. And a lot of our meat eaters, we will see an elevated level of that because that's where the arachidonic acid comes from. Not dangerous, but we might be able to balance better, therefore affecting her omega-3 index. And one of the things we also know is that fatty acids do also play a role in migraines. So very interesting how lots of these different nutrients in the literature we can relate back to being triggers or even allowing exacerbations of the migraines. And if we get that back in balance, we may not have had those issues. So, you know, the omega-3s were really important. We used a little bit of that for Katie. We want to make sure when we do that again that they're in balance so that we don't trigger an upset also in the other direction. We know in the literature that it leads to a significant reduction in the duration of a migraine as well. So not only to prevent, but to help pull them out so that, our patients aren't laying in bed for 24, 48 hours with a migraine that we hopefully could have eradicated pretty quickly. Another really nice thing is to couple some of the supplements. So using the omega-3 fatty acids along with curcumin, which we know is a great anti-inflammatory, these two in combination will reduce the attack and the frequency and the intracellular adhesion of what's called molecule 1 serum levels. This is an endothelial factor that leads to the adhesion of the leukocytes to the wall of the cerebral blood vessels, which then lead us to an inflammatory change. So, a lot of us have probably been using curcumin in our practices for a lot of musculoskeletal conditions, but how about adding that in now for our headache and our migraine patients? Riboflavin, remember I mentioned B2. We've seen reduction in migraines using as little as 400 milligrams of that riboflavin. And there are studies that show even over just a 12-week period versus using a placebo, there was a huge reduction in the incidence of migraines. And it's working even better than some of the medications out there without any of the side effects. Unfortunately, a lot of the prescription meds and valproate is actually used for epilepsy. We see a lot of side effects like nausea, vomiting, stomach discomfort, etc. With B12, or excuse me, B2, B12 too, but wow, that just got confusing, didn't it? B2, yes, you can use B12, but B2, very safe, no stomach upset, real easy on patients in order for them to take the 400 milligrams daily. Magnesium. I mentioned that red blood cell magnesium wasn't enough, and I think for those of you that do some testing, you are going to see quite frequently that red blood cell magnesium is very rarely over 6 in most of your patients. As little as 600 milligrams can be very effective, and sometimes, yes, we work up. Also, headaches related for female patients to menstruation. Magnesium is very, very good for female health. It helps not only from a headache standpoint, but even just for good uterine health, especially if they're suffering from cramping, low back pain, any sort of abdominal pain. The magnesium can help take that away. And as a side note, magnesium is also really good to lower your blood pressure. So some of our patients are getting headaches associated with the spike in blood pressure that happens, and the magnesium twofold will work to bring that blood pressure down and eliminate the headache. Anything lower than 6, again, on red blood cell magnesium, I would treat. 3 different forms of magnesium I really like. The threonates, the beauty of the threonate is it crosses the blood-brain barrier. It also causes absolutely no GI problems at all. So you can play around. Some patients swear by one versus the other. I have seen all 3 be very beneficial in our headache patients here in the clinic. And then we've got CoQ10, right? So an antioxidant, we found this on Katie's micronutrient test too. Her CoQ10 was pretty low. This is a nutrient that as we age, we also tend to become more deficient in. So a very common thing. We also have to be really careful. If any of your patients are on any sort of a statin, that statin will also drive down the CoQ10 levels. So please make sure that you're supplementing with at least 100 milligrams of CoQ10 for your patients on a statin, and then do your good work that hopefully they won't need that anymore. But we've seen that this lowers blood pressure. It reduces the duration and frequency of migraines, and again, no serious side effects. Do be careful with your patients that are on any sort of anticoagulant or insulin therapy, as this can interfere. The other thing I want to point out is there's a lot of really cheap, I guess that's a good word, cheap forms of CoQ10 on the market. So this is a nutrient that is probably not going to be $8 a bottle. So sometimes you get what you pay for. Also, please know that CoQ10 is actually orange, just like it is in the picture. There's a lot of supplements out there that don't have the right color, which should give you an indication as to the poor quality that is very commonly found out there in the nutraceutical industry. Vitamin D. Oh boy, vitamin D seems to slip in no matter what I speak about. We tend to incorporate vitamin D because A, it's really important. B, we see a lot of deficiencies across the entire country. C, it has an enormous amount of anti-inflammatory properties. And what's really interesting is it behaves actually more like a hormone. So lots of correlation between your vitamin D levels and headaches. We also know that, again, anywhere from 30 to 80% of children and adults worldwide are truly deficient. Now, what does deficiency mean? So if you run a serum vitamin D level, again, on your blood work, most labs are going to tell you that normal is somewhere between 30 and 100. I have seen patients as low as 7. In the functional medicine space, we like that number to be somewhere between 60 and 80. So even our headache patients, if they're sitting at that 40, 50 range of vitamin D, we tend to supplement. We want to make sure that we get them into those adequate levels. Vitamin D also affects about 200 genes, and it can also help increase that absorption of magnesium. So if we're trying to get that magnesium into the patient and the vitamin D level is low, that's going to make it more difficult to get those levels up over 6. So really, really super important. If a patient winds up with a vitamin D over 100 on a blood test, we just cut back a little bit. It is fat soluble, so we don't want it to, we don't want it to basically hold in the tissues. And also to increase the absorption, a couple good ways to give vitamin D is in a liquid emulsified form. That way it doesn't have to go through the large intestine, where we hope that the large intestine and the absorption properties are working well. And 2 is to give it with a fat. So taking it, usually I recommend at dinner time where there's usually a fat in the meal, will also help increase the absorption. And you can see at the very bottom of the slide in the literature, we do know that even doses up to 10,000 IUs a day is very, very safe. But again, run your labs, get the values, and dose appropriately based on how low or how normal their labs look. The other beautiful thing with nutrients is we don't always have to do everything through supplementation either, right? Which is lovely. Sometimes we can just use food sources. So this shows you, based on her specific results, what we could do from a food standpoint. So let's just look at that valine again, for example, that amino acid that was really low. We can take a look at whey protein, cheese, although most of you that know me know I'm not going to recommend dairy, but it's still in cheese. Eggs, soy protein, lamb, and beef. Those are good sources for her in order to get the valine in versus supplementation. And you can see the remainder of the list there. Some of my patients would really prefer to do it on food. Some, there might be this list where they just don't enjoy those foods where we have to supplement. And most of the time, if I see a true deficiency, I normally recommend that we supplement first, get those levels back up to normal. We retest in about 6 months at a minimum, a year at the latest. And then at that point, if their levels are great, then we start to pull the nutrients and we use food in order to maintain. 6 months post-treatment. Katie did all the nutrients that were necessary based on the test. I actually just saw her last week for a follow-up visit. It was fantastic. And she said in the last 6 months, she's only had 1 migraine, and she attributed it to actually when she had COVID, which I believe was a completely different mechanism at that point, although not 100% sure, because we know selenium and vitamin D being low is actually a trigger for worse symptoms with COVID as well. So it is still possible. Her levels aren't perfect, and she is scheduled to retest. But in the meantime, absolutely great. The symptom we were most worried about in terms of her migraines was actually pretty much resolved. So make sure you're checking nutrients on your headache patients. See if those are the underlying triggers. It's also worth noting, and we won't spend a whole lot of time, but there is such a thing as a dehydration headache as well. So make sure you're talking to your patients about water. We see this a lot in sport with our athletes. They're not getting adequate water, and then the dehydration headache sinks in. And what's very interesting is when you're not getting enough fluid in the body, the tissues and the brain can actually start to decrease in size. And what happens is then the brain can pull away, so to speak, from the skull a little bit, which puts pressure on the nerves, causing the actual headache pain. So water, water, water. Coffee's not water. Tea is not water. Gatorade is not water. Make sure they're actually hydrated and getting enough water in their daily regimen. Okay, let's move on to a little different subject, and let's talk about hormones just very briefly. And we could probably spend a half day looking at all the different hormone levels and the precursors and the metabolites. But just real simply, this was a great case where Laura came in to see me with what we just labeled a PMS headache. She knew when she was ovulating, and she could tell that prior to the onset of her period, and even sometimes at ovulation, she would get an excruciating headache. So we ran a hormone panel on her. This on the corner of your screen there looks at what we call a rhythm panel, where on the top we measured her estrogen levels. The blue in the middle measured her progesterone levels, and all the way at the bottom we checked her testosterone. And we mapped that out over the course of her entire cycle, starting with day 3 of her period, all the way through to right before her next period. Now, for those of you that have never seen this before or don't know how to read these, I'm going to make it really easy. All those little black dots or squares should be in that dark blue and that dark green graph that shows the proper pattern of estrogen and progesterone over the course of an entire month-long cycle. Well, you can see on Laura on the top, all of that estrogen is sitting way higher than it should be, especially compared to that progesterone. So it's what we call a state of estrogen dominance. And sometimes when we see that estrogen dominance, that's what can trigger a lot of the PMS symptoms: headaches, mood swings, breast tenderness, crabbiness, crying for no reason. And in this case, it was headaches for Laura. Also, as a side note, sometimes we see when there isn't enough estrogen, that also can trigger a headache. So don't rule out the sex hormones on your female patients and even your male patients to see if that potentially could be one of the triggers. When we got that regulated for Laura, it took us about 3 months. We went through about 3 cycles of treatment. We used some herbal formulas to help balance the estrogen dominance. We used some calcium D-glucarate to help pull that estrogen through the liver. And we took a look at her lifestyle. There's what's called xenoestrogens, which means she's exposed to things out in the environment, whether it's through makeup or lotions or chemicals or caffeine. And there's all types of different places she could have been exposed to elevate that estrogen in her body. And we spent a lot of time trying to eliminate those from her lifestyle. And after 3 months, we had no more hormonal headaches. And just in case you didn't believe me, yes, we find incidence with men as well for migraine headaches having a higher incidence of estrogen levels. Now, we're not going to map them out like we do a female over the course of the whole month because they don't cycle, but certainly we can check these levels either in blood, saliva, or urine. Saliva is probably my favorite, looking at a free fraction protein, but we have seen that there's elevation in a lot of our men. And remember, men are getting exposed to these through the xenoestrogens as well, and quite frankly, a lot of our tap water. Women who consume the birth control pill, when they excrete some of that medication through urination, that goes into our water system, and quite frankly, we don't filter that out. Maybe really good at bacteria and all the bugs, not so good at estrogen. So men are getting exposed more and more to estrogen through the environment that they live in. Make sure you're checking those levels in your men too if they walk in with that migraine headache. Then we have Janine. This is that sinus headache, right? The pressure, the sinus infection. Want to just give you a little clinical pearl here, things to think about. Most sinus infections that have walked through my door are actually not bacterial in nature. They're actually fungal in nature. And that fungus that sits in the sinus cavity can work its way up into the sphenoid sinus, causing a lot of headache pressure. So we do things not only that are antibacterial, but also antifungal. We can also culture some of the discharge that comes out of the nasal cavity to confirm whether it's bacterial or fungal. And sometimes you can actually have both. And interestingly enough, sometimes we even trace this back to the gut. So if there is, let's say, a fungus growing in the gut, it loves warm, moist places. Besides the gut, the sinuses are a lovely, warm, moist place to hide and grow. And sometimes that's what leads us to the sinus headache. So we do a lot of talking about that gut-brain connection, right? Very, very common. And this might be one of those places that there is a connection. So don't rule out a yeast infection and sometimes bacterial in the sinuses that's leading us to the headache, and treat from that standpoint. GI disease is so commonly associated with migraine headaches, and there's tons of information in the literature this way too. A lot of times we know our headache patients, right? Not only do they get the headache, but they're talking about feeling nauseous. There's a lot of vomiting. There's dyspepsia, even just stomach disturbances that can go along with these particular headaches. And we've seen that they occur at a much higher rate in our patients with the GI disorders. Okay, so make sure if you're looking at head, again, that goes back down the gut and you clean up the gut. We also see a very high incidence of inflammatory bowel disease. and celiac disease as well. We see leaky gut. And testing for the leaky gut, we want to assess things like zonulin, occludin, actomyosin, like lipopolysaccharides. All of these are markers that, if elevated, we know there is intestinal permeability or leaky gut. And then what happens as a result of that, we have a lot of these pro-inflammatory substances that then may actually reach the trigeminal vascular system and triggers that migraine or that headache. So make sure we're healing the gut as well when we have headaches. We also want to take a look at the entire microbiota and make sure that there's balance of the good bacteria. We also produce some of our monoamines, our dopamine and our serotonin in our gut. So again, if that's not healthy, now we have the neurotransmitter imbalance, headache, that then eventually also leads us to the anxiety and the depression, or the circle goes the opposite way, right? And it's a bad cycle to get in. Some of our stress hormones can also play a role, our cortisol and our DHEA, and then again, our nutritional elements. So looking at the entire body from all of those systems may be really important in order to find the underlying trigger. And then again, certain probiotics, there's all kinds of different species within that lactobacilli family and that bifidobacteria family that may be able to help. And some of the stool tests out there can actually give us the exact ones that we need in order to get that properly balanced. Then there's also our food sensitivities and even some environmentals. Food sensitivities are very interesting to me. We've been running those for, oh boy, well over 20 years. And what's interesting is, besides headaches, there's probably over about 200 other symptoms that we commonly see. One of the things I want to point out is headaches in children. Kids complain about tummy aches pretty frequently, right? That's a pretty typical symptom, whether it's really accurate or they're just nervous about something or they're trying to get out of something. When a child actually complains of a headache, we take that much more seriously. And again, we work up the stomach, the tummy complaints certainly too, but the headache obviously is a big concern, right? And just as a side note, we're not ignoring the fact, of course, that if headaches come out of nowhere, they seem to get worse over time. We're absolutely imaging. Okay, so please don't miss that component as well, even though that wasn't the purpose of today. We obviously want to make sure that there isn't anything physically wrong in the brain itself, of course, ruling out the most serious of a brain tumor. But if we work that up appropriately and we're very confident we're not dealing with that, in kids, one of the biggest triggers we find is foods. So we can actually run food sensitivity testing, and there's huge varieties out there. My favorites are going to be the labs that have a very broad panel, number one. Two, they're going to look at multiple pathways. So they're going to look at not just an IgG pathway, which is an antibody pathway. That's very common in some of the more simple and less expensive tests that anybody can just go online and order. They also can look at an IgA pathway. They can look at a cell-mediated pathway, and they can look at what's called a zoomer, where it breaks some foods down into their polypeptide components. So for example, let's take milk. If we look at milk as a whole protein, we can test that, and it may or may not trigger as being pro-inflammatory. But if we take milk and we break it down, which happens through digestion, into whey and casein, those might actually trigger a response. And then there's a few more little polypeptides that get broken down even further that also can be pro-inflammatory. So when we take certain foods that can be broken down like that, milk, wheat, grains, egg, seafood, nuts, etc., we don't miss then what could be a trigger for the headache that we would normally miss. So again, just bear in mind, in the food world, there is a ton of variety. And again, if you need help in any regard, just reach out. I'd be happy to point you in the right direction of the different labs and what the pros and cons are from that. Okay. With the food sensitivities, when we have a young boy or even an adult and we run the food test with the headaches, we always pull the foods out for approximately 3 months. We monitor over that course of time if the headaches dissipate or go away. And assuming we get complete resolution, which we hope for, right? If it's only a food trigger, then we start to reintroduce the foods one by one. Reintroducing singly allows us to see if we've really reset that food sensitivity, which typically should not be permanent. And then that way, if a food, as we put it back in, triggers the headache, we just remove that again and give it a little bit longer time to see if we can keep them off the food to reintroduce. So make sure you're considering the foods that the patients are consuming. If you don't want to test, certainly you can keep some food logs, see if you can find some patterns as to when that headache peaks in relationship to the foods that they're eating, and pay attention to timing, because food sensitivities can affect you from the moment you eat them up until about 72 hours later. So it's not always an immediate trigger of like, oh, I ate a bowl of ice cream and the headache kicked in. Sometimes it can be, you know, I ate shellfish or had, you know, tons of bread 3 days ago, and now the headache is kicking in 72 hours later. So make sure if you're watching for patterns, you look back about 3 days prior to the headache to see was very prevalent in the diet. Other foods just in the literature that trigger migraine headaches, even if you're not testing, you can certainly play with eliminating these from the diet. Chocolate is a big one. Cheese, and I would play with all cheese. I would remove all dairy products. Anything that has to do with a cow's milk protein, I would eliminate completely and see if that resolves it. MSG, right, which we find in foods as an additive. Any foods with tyramine may be a trigger, and I listed there for you some of the more common ones: the red wine, aged cheese. Oh, that should say smoked fish, not smoked fist. So there's the funny, I guess, for today. Nobody should be eating their own fist, okay? And I guess this makes me human that we found one error, so that's a beautiful thing. Chicken livers, figs, and beans, okay? Other good sources of the tyramine. Nuts, peanut butter, avocados, bananas, citrus, and the list goes on there. Now, at the bottom, the key behind, and that's a little bit of a, you know, not familiar food, right? Caffeine. It's actually the caffeine withdrawal that can also be a trigger. So sometimes it's caffeine itself, although counterintuitive, because we usually use that in order to dilate, right? When there's a constriction in order to help. So caffeine a lot of times will pull people out unless they are sensitive to the chemical caffeine, then it's actually a trigger. But the withdrawal, when patients come off, can also trigger the headaches, okay? So we want to wean them off slowly. There's some herbal coffees out there too that sometimes we mix with the regular coffee in order to wean them down, and then certainly fix the underlying reason they needed the caffeine in the first place, so that they don't actually need caffeine in order to get through their day. In the literature too, we look at all kinds of different diets. The ketogenic diet does have some value for some patients. That's assuming that they can absorb and break down high fats well. There's that high folate that comes in, again, making sure those levels are good. Sometimes we actually need low fat. So isn't this fun? Sometimes more, sometimes low. Every patient is a little bit different, but they all can be triggers for headaches. Modified Atkins, and even the Mediterranean diet, which I happen to love. There's that high omega-3 and low omega-6 again. So lowering that arachidonic acid or the linoleic acid in a lot of our meat eaters, making sure we're getting better fatty acids in the sense of the omega-3s will have a really good effect long-term when we're looking at diets. And then there's epigenetics. And back in 2011, this term was coined, and it's really the study of how we look at how our environment can actually interfere with our genetics from a diet standpoint, right? And it's very fascinating how some of us can eat certain foods and do really well, and then some of us can consume those same foods, and it has a profound effect to actually flip those genetic switches that can lead us to disease. So for those of you that are doing any genetic testing, at the bottom, I listed a bunch of different genes that actually can be associated with the occurrence of migraines. And again, this has to do with the methylation process. So being really careful that we're giving patients the right supplements, knowing that from the time they take it in to the time that it creates some sort of output, they're actually utilizing that supplement appropriately with all of the right cofactors along the way. And there's tons of really cool metabolic testing and genetic testing that we can now do to make sure that we're giving patients also the right cofactors along with the supplements in order to achieve the proper outcome. And lastly, there's John. There's our good old fashioned friend, John, who just comes in with that typical musculoskeletal complaint where we start to do all the good work that we do, right? Whether it's adjustments, massage therapy, ultrasound to car therapy, you know, pick your favorites, right, from a musculoskeletal standpoint, and treat appropriately. We happen to do a lot of work in our office in combination with acupuncture. We find that adjustments along with that treatment and even some of our physical therapy modalities gets them better faster and quicker, and also tends to keep them really under control from a maintenance standpoint. And lastly, but certainly not least, this is where our topical analgesics come in. Love using those in combination. One, to potentially pull them out of a headache when they have symptoms, but certainly also to use along with care, not only in our office for us to send the patient home with those particular products so that they can use them, especially if they don't have access to come in when a headache hits. We want to make sure that we're exploring some non-opioid alternatives as well, right? We know the dangers there. I probably don't have to tell you about those. We see them every day, whether it's in the news or in our own practices. We want to make sure we have some other options. As I mentioned earlier, we have over 39 million people suffering from headaches. 157 million workdays are lost per year due to migraines. And here's what's interesting, is there was a study that was done by ChiroHealthUSA, and they looked at 900 migraine sufferers, and they said that almost half who responded to the survey indicated that even the over-the-counter medications were only somewhat effective. It really didn't pull them out the way they wanted. And 1 in 3 of the respondents said that they weren't effective at all. So we really need something else that we can send home with our patients so that they can help themselves when they don't have access to us, or even if we're not sure what the underlying triggers really are yet. Also, more statistics from this particular study. You can see there the frequency of migraine, and it varies from patient to patient. We also know that there are pretty significant risks with a lot of the medications that are used, right? So we're setting our patients up to have other problems that we're going to have a much harder time treating long term. And we know that using some of these topical products can actually help to relieve both the headache and the migraine pretty drastically, okay? And I'm going to show you that in just a second here. A couple herbal things just to spend a few minutes here that I really like that we've used in practice for a long time, and herbs used to be my go-to. Feverfew was probably one of my favorites. Really good to reduce the migraine, headache frequency, pain, as well as the nausea and vomiting that can be associated, and even the light sensitivity. It's good to use ahead of time. There were no serious side effects. The only thing you had to be careful with is if a patient was on a blood thinner, this could actually exacerbate that. And if the patient was allergic to ragweed, they may have a sensitivity to feverfew. So be careful if you're using that herb with those allergies. 5-hydroxytryptophan, also another great precursor, especially if the neurotransmitters are affected. This is one that converts pretty easily to serotonin to help boost serotonin levels. And we know that as a result of abnormal serotonin related to migraines, getting in through the back door through the 5-HTP might be the perfect way to do that. Anywhere from about 200 to 500 milligrams usually works really easily. Just be careful if your patients are on an antidepressant, it can potentiate that, or St. John's wort or SAMe. So some of that can be contraindicated. You just want to be real careful if you're dosing the 5-hydroxytryptophan. And then butterbur. Butterbur, there's some controversy on. And the reason behind that is because a lot of the butterbur products actually contain components or alkaloids that can damage some of our organ system. So if you're using butterbur, just make sure you're buying it from a reputable source, that it's really clean. It's got to be labeled as certified, that it's PA-free. And again, watch for sensitivities with allergies in patients, ragweed, chrysanthemums, marigolds, and daisies. Patients who are sensitive to those particular flowers will have a reaction if they take butterbur. I've since moved and really excited in the homeopathic world, right? So lots of information on homeopathics, some good and some bad, right? It's getting a little bit of press that I find very interesting out there. But homeopathics have been around for a very long time. And when you dig into what they do, it's really unique because they have very specific characteristics that they treat. So what I did here for you on these next few slides, and by the way, you're welcome to take pictures of this, and I know this will be recorded so you have access, and even if you want a copy, you can shoot me an email. I'd be happy to send that to you. It gives you the issues that these particular homeopathics are very, very good for, okay? And I incorporated not only on the headache front how they work, but a little bit too sometimes even in that female health or general health from a stomach-gut standpoint, because again, we know that gut-brain relationship. And at the same time, the product that I'm going to recommend at the very end, there's, the spoiler alert coming, works really well for a lot of our female patients with PMS type symptoms as well. So you've got a list there of all the great things that it does from a headache standpoint, belladonna, one of my favorites. It's also a really great children's remedy. We use this a lot in our pediatric population. Very, very safe for kids. Nux vomica is actually a product I also use a lot by itself as an individual remedy. Works really great for any sort of mental strain, has to do with the headaches when you can't bear noises or the lights, right? So a lot of sensitivity here too. This is the remedy that's great. Like if you describe, like it almost feels like somebody is driving nails through my head. Great for nausea and vertigo. Actually, it's a go-to for me, for anybody who has a lot of nausea. And you can see the rest of the list there as well. So now not only do we have it as a single remedy, but we're starting to look at how we can couple some of these homeopathics to be even more effective in the patients when they have headaches. Iris versicolor is another one. This is really great for what we describe as a sick headache. Also very common with blurred vision or after eating sweets. Now, I'm going to tell you to cut out the sweets, but for those patients that won't do it and the headache starts, this is a great homeopathic for that. Also, as strange as this sounds, you ever have the patient that walks outside and says, you know, when I'm hit by the wind, like when I'm out in fresh air, I get that headache. That's where this one plays a really, really great and very effective role. Sanguinaria. We've done a ton of sanguinaria. It's really fascinating how we've used some of these remedies by themselves. This is really good for a lot of patients as they're going through perimenopause and even into menopause. We see it helps. Headaches, again, interesting, worse more on the right side. Sometimes if you're out in the sun too long, right, that occipital pain, this is a good one for that. And the description that way is almost like a flash of lightning that they get in the back of the head near the occiput. Sanguinaria works beautifully for those types of headaches. And lastly, menthol, right? A lot of us have been using topicals with menthol in it for a very long time. This is great for not only the frontal headache, but again, those sinus headaches that we have involving the eyes, which is really great. Any sort of discharge as well. So when we get the congestion, not only in the nasal cavity, but even in the oral cavity, this can help move some of that congestion in order to decrease the severity of the headache. And then certainly muscular pain, right? We've been using this for a million years, especially in the chiropractic physical therapy world, right? Where we apply this directly to the muscles and it helps relieve some of the soreness that we have that can then be associated with the headaches. So what would be really amazing is if we actually took all of those fantastic homeopathics and we combined them into one product. Well, you don't have to look any further. There is my pitch for you, right? And this is why a big, huge thank you to Stop Pain Clinical. The reality is they took these homeopathics and they put it in a very unique, one-of-a-kind product that, quite frankly, in over 20 years of practice, I have never seen or used before until I got introduced. And it is a wonderful topical. They come in little single packets, one dose, right? So you don't have to measure anything out. Patients aren't using too much or not getting enough. And it's actually applied to the back of the head, underneath the occiput, even behind the ears. We stay away from the eyes. So even with a frontal headache, it goes behind. And what's lovely is the minute you start to feel a headache come on, this can be applied. And then if after 30 minutes the symptoms are still there, we can apply it again. And we use it up to about 4 times a day. And what's fun, again, clinical pearl, side note, besides those migraines and those headaches, we're also using it in a lot of our female patients for, again, that PMS discomfort. Okay, so you get the menthol, you get all of those homeopathics in one, and you get these individualized little packets, okay, which is absolutely fantastic. We saw in another study that was done then with the product, by utilizing this, we saw 52% improvement. We saw by at least a severity level, 96% improved in actual headache pain, and 88% complete resolution of the pain 24 hours after application. And unless you have a sensitivity to something that is in this product, no other contraindications where you can start giving this to your patients. They have it. They're little tiny packets. They keep them in their purse, their briefcase, their back pocket, their car, their glove box, their home. No reason not to have these, so that the minute that pain starts, you can start to apply this. And I think, as Christy mentioned in the beginning of the intro here, she even told you she was given one by Paul, and I'm pretty sure that pulled her out of what may have been a way more severe headache when she was at her program over the course of the weekend. So how do I using the topicals? Well, there's two components of this. One is the migraine and headache product, which I absolutely love. And quite frankly, I'm even nice enough sometimes to just give those samples to the patient, and then they come back wanting boxes and they buy more, right? So it's a great way to introduce them to it. We also use it in the practice if they walk in with a headache. And in combination, we're using the Stop Pain Clinical topical as well that we use for all of the typical stuff we're using, right? Cervical sprain strain, low back pain, calf pain, etc., right? Anything we would use a topical for, we're doing in conjunction. So I use it while I'm treating. We use it under kinesio tape. We use it with our physical therapy modalities. We use it just massage or trigger point, soft tissue work. And then we send the patient home with a tube of it, along with the migraine and headache, so that they have it when those symptoms kick in and they're ready to go, right? They don't have to stop back in the office in order to start getting ahead of some of those symptoms right away. We've got a wonderful little comparison chart here just for fun. The marketing side of things, it comes in different applications. And this is the other thing I actually really love. I personally do not like the sticky touch all the time with a lot of my topicals when I'm out and about. I don't always have, the means to wash my hands, right? Although we all should. But what I love is we also have the topical in a spray and a roll-on, which is lovely. And especially the spray, even because, sometimes getting to some of those back points are really hard. We can hit that without being able to not be able to reach. So lots of different applications in the topicals that we use along with the headache and migraine formula. More marketing support. So, this is a lovely thing too. You want to get patients well. You want to build your practice. You want to provide more value, which I think is key for the patient. We've got handouts. We've got little cards. You can put your business card and a sample in. As I mentioned, I leave these in my exam rooms. I have them in my conference room. We have them at the front desk. We let patients take samples all the time, and they keep coming back for more. And Paul can tell you I'm always calling him because we need to place another order and refill our displays. The stuff flies off the shelf. It's just been fantastic for our practice. I want to encourage you all. We are walking into migraine and headache month. So we are actually going to hold a migraine and headache virtual summit. So you can sit in your pajamas and take a look at what we're going to talk about. This is June 15th. So I want to invite you all. We're going to do it from 6 to 8 p.m. That's Eastern time. So in my world, that's going to be 5 to 7 and earlier on our West Coast. There's a QR code for you there. You can scan or visit. This is being put on by both Stop Pain and Script Hesco. So please scan that and join us. You can see all my friends on the left-hand side there. We have some amazing people. Drs. DeFabio, Tucker, Bertelsmann, and Greenstein. We're all going to be there talking about how we treat headaches, and we're going to give you a whole bunch of clinical pearls and talk about how we use this product as well very successfully. And because I have about 18 seconds left before our hour is up, I want to give you a big, huge thank you for hanging out with me and the Stop Pain team today. You're invited to learn more. There's another fun QR code for you. I want to send you a sample. Please, let's try it. Try it yourself. If you have headaches, try it on your favorite and your not so favorite patients, right? Anybody who walks through the door with a headache, they're all our favorites. I was just kidding about that. Give it a shot. Check out that QR code. Please let us send you a sample. And you know what? Give me some feedback. There's my cell phone again. Text me. Ask me how I use it, how I can help you. Let me know what you think. We would love to hear. We always want to make things better and more useful for our patients as we're educating out there. And again, thank you all. It's been a wonderful almost hour with you. And I can't wait to be back talking to you guys about this again sometime in the future. Come see us. Thanks, Christy. It was so fun. I'm glad you had me. That went way too fast, by the way. Way too fast.
It always does. Thank you so much. So make sure you do request that sample. It's so funny. I don't even remember. One of our many adventures when I was introduced to Paul, and he was telling me about their products and sent me some samples. And the funny thing about the migraine is Heather and I both were like, yeah, does it actually work? Because nothing ever actually works. And of course, within like a week or two, we were somewhere, had a headache, whipped out the sample pack, and we used it, and we loved it so much that everybody on our team actually carries these on the road with them, and the roller. Stop pain for, low back pain, leg pain, feet pain, everything from standing up in a booth for 10 to 15 hours at an event. And so this is just incredible. And every time somebody tells me they have a headache, I'm like, oh, let me send you a sample of this. stop pain migraine. And I love the provider locator on the website. My aunt fell, was having low back pain, and she didn't want to take the pain medication that her doctor had prescribed. And I was able to find a provider that was 10 minutes from her house on a Saturday that was open. And I called, and they had the roller available, and her husband was able to go pick it up for her.
Isn't that
So
awesome? Yeah,
it is.
I don't even get migraines, and I carry it with me anyway, just in case, it's fun to arbitrarily hand them out, at a grocery store or on an airplane or wherever somebody has a headache. So I carry them with me regardless. So again, if you run into me or Christy or Paul, you can probably help yourself to a packet or two. But yeah, it is wonderful. Yeah, we'll make sure we get it in anybody's hands that needs it. We'd love to get it in, everybody's to try. It's been it's been a great asset to my practice. There's no doubt about it.
I absolutely love it. Like I said, I don't really talk that much about different products. I mean, we try stuff all the time, but this one I actually carry with me, except obviously for this weekend. But then Paul was there like a beacon of light and hope and saved the day. So definitely make sure you utilize that. If you have questions for Cindy, she's provided her cell phone number here. Again, text is the easiest way to get in touch with her. I've also posted her email address, drcindyyhoward@msn.com, in there as well. But again, text message is the fastest way to get a hold of her. So if you have questions, reach out to her, or you can email me, and I will, get those to Cindy and get those answered for you. I want to thank everyone for joining us today for our weekly webinar series. We look forward to having you join us again next week when we have Dr. Sherry McAllister, who's going to be joining us to talk about setting up your team for setting up your chiropractic team for ultimate success. So we're really excited about that. So everyone, have an amazing rest of your day and a fabulous week. We'll see you next week. Bye, y'all.
Bye. Thank you.